as humanity, I think we're connected in unprecedented ways today. And I think you can't continue to be a hospital that's only serving your local community and population, as great as ours is. You build relationships, and in a city like Los Angeles, they inherently take you global because of all the just interconnectedness we have with the global community. So I think built on that, if you look at that from an ethos perspective, we then take a strategy and execute a strategy that's more purpose-built. And how do you build those relationships and to be sustainable? And for us, there's a number of ways we do that, and I'm sure we'll get more into that. It has to do with marketing and branding, to opening offices and clinics overseas that we wholly own, to, in our view, when we go into actual inpatient or even significant outpatient care delivery, we'd rather do that in collaboration or affiliation with partners that have strong local ties. We just think that's a more sustainable option than going at it alone.
Welcome to the Health Beats podcast, brought to you by the inaugural Abu Dhabi Global Healthcare Week. The Health Beats podcast is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We give you insights into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakin, and in this week's episode, I'm joined by Dr. Heitham Hassoun, a vascular surgeon who also serves as the Chief Executive of Cedars-Sinai International. Our conversation today is entitled Healthcare Horizons, Breaking Boundaries and Forging Connections. Dr. Hassoun, welcome to the podcast.
Thank you. It's a pleasure to be here, and I'm excited for the conversation.
So you've been in international medicine and collaboration for many years. Tell us what you do, how you do it, and how it's different from how things used to be.
Yes, it's amazing, really, the journey I've taken personally. And my career, I say, is fully entrenched now. And doing global healthcare is kind of the term I most use, but there's so many ways to look at delivering care to people wherever they are. And however we achieve that objective. I'm a true blue academic surgeon, vascular surgeon. I started my post-education and training as a faculty. I started at Johns Hopkins. And early on in my career, Hopkins was really out there in the world doing things in so many different dimensions when it comes to international. And it really opened my eyes to a world of opportunities. And I guess I have that personality or that background really where doors open and I really wasn't afraid to take them. And it's gently, or maybe not so gently at times, over the years have shifted my focus from a true blue academic surgeon doing, really having a research lab, doing clinical care full time, and shifted towards more of a hospital executive, which I am today. Fortunate to be at what an amazing institution, Cedars-Sinai, amazing city, Los Angeles, and I'm our chief executive for international, and been here about 5 years, and we're just excited and building a great team and a great purpose in our international aspects.
So Cedars-Sinai, one of the best hospitals in America, you're used to people coming to you for care. So how do you push that out into the world?
Cedars-Sinai is a quintessential and built and designed to be a community hospital engaged with its local community. It serves its people, both providers and patients and the like, and continuously thinks and behaves in that way. And I think it's only natural in today's world, as we continue, despite, and I'm sure we'll get into some of the current times and regional issues and what have you. But if you think of it more broadly as humanity, I think we're connected in unprecedented ways today. And I think you can't continue to be a hospital that's only serving your local community and population, as great as ours is. You build relationships, and in a city like Los Angeles, they inherently take you global because of all the just interconnectedness we have with the global community. So I think built on that, if you look at that from an ethos perspective, we then take a strategy and execute a strategy that's more purpose-built. And how do you build those relationships and to be sustainable? And for us, there's a number of ways we do that, and I'm sure we'll get more into that. But it has to do with marketing and branding, to opening offices and clinics overseas that we wholly own, to in our view, when we go into actual inpatient or even significant outpatient care delivery, we'd rather do that in collaboration or affiliation with partners that have strong local ties. We just think that's a more sustainable option than going at it alone. So we can dive into those concepts more, but that's from a general sense, how we think about it and how we're approaching it.
How has telemedicine transformed access? What are the pros and cons?
Well, yeah, no doubt. Everyone knows it's been one of those technologies. I'll tell you a little story. Actually, my predecessor, Dr. Spencer Kerner, he was a practicing physician at Cedars for since the 1970s. I think he came out from New York as one of the original kind of academic physicians. But after his first retirement, he had this vision to do telemedicine. This was in the mid-1990s. And, I think that our international program was actually originally built as a center for telemedicine, and then international got layered onto it. And the reason why I tell that story is because, for us, it's just a fundamental tool or way that we can reach more lives and try to improve the continuity of care. And so we still view it that way. I mean, there's no doubt that before the pandemic, most of this has been driven by, technology or those startups and companies who have a tool or a way to connect people and want to find a medium to do that. And I think obviously the regulatory practice the culture and the regulatory environment are just not there. The pandemic obviously forced us to go in that direction. And I think Cedars-Sinai, like other hospitals, fully embraced it immediately. And we continue to do so of our, almost 3,000 patients and 17,000 encounters per year that are international patients. Almost 15% are through remote means, so we call sort of telemedicine. I think that's a pretty good number, a healthy number. And, I think that it's not replacing in-person care by any means, but I think it allows us to create a better continuity and connect the dots. And ultimately, that's the biggest challenge. The further distant you are from your local care providers, the more likely you are to, not have that all consolidated and have a continuous journey, throughout your life. And right. So I think telemedicine, again, I guess is a tool, is a means. And we embrace it, and we want to continue to adapt better ways of doing it.
Cedars-Sinai does some very innovative things with technology, pushing the frontiers. How do you push that out? How do you scale that to your patient community around the world?
Today, it's hard to talk about healthcare without someone wanting to push technology to the forefront of the conversation, whether it's AI, machine learning, it's the processes, whether it's the digital tools that we're using. The alphabet soup of companies that are coming out each day, and private equity and capital is being infused into transforming healthcare. It's all happening before our eyes. There's no doubt about it. We can see it, and technology is probably first and foremost at the forefront. I think for us, I take a step back and think, again, as I mentioned, and I think the theme of how we think it's about people. Maybe I'm a little bit traditional in that sense, as a physician, as a surgeon, and it's about first and foremost, it's connecting with people and creating those relationships. And then we layer in tools, whether it's enhancing the patient experience using technology, and we can certainly talk more about that, whether it's being able to measure and quantify healthcare outcomes and quality standards, and certainly whether we're able to deliver care itself using tools to more people. And I think if you think about it, what trumps it, what some of that technology to me is being in a position to deliver it. So without some of our regional offices, Singapore and China, what have you, we're not going to be able to connect with, some of that part of the world without creating those relationships that are able to use the technology. So it is almost moving faster than we can understand and absorb, and it's leading to a lot of sort of putting the care into the consumer a bit, and we're mindful of that. and we also embrace it. But I think technology is obviously critical.
And how do you build in that hands-on clinical experience, creating culturally competent physicians? What are some of the bridges that have to be built to make international medicine work in collaboration?
The movement of patients across borders is timeless, right? It's been around forever, but so has the movement of providers to learn and to train and to develop or to provide care. It's not like only a modern day thing. So I think for, the way I see it is it's just really about kind of upskilling. I do think if I look out into the world, and I won't pick on any particular part, I think if you look at sort of environments that maybe economically are catching up more quickly, or maybe the healthcare economics, let's say, or environment are, it's a lot easier to go in and build facilities and to invest money and to recognize that there's a need for these services. What's a lot more difficult is to create the like you said, culturally competent workforce. It's not just doctors, it's nurses, it's administrators. It's really takes the whole team. And I think, for us, we don't, that's why we're approaching it on multiple levels. We want to be with universities at the ground level. We have collaborations in Abu Dhabi, in the UK, in Korea and other countries, where it's really about, focusing on education and research. And how do you build, whether it's faculty development or even just very basic medical student, nursing student rotations. We provide those, we embrace those. We want to provide that experience, but also to be in those environments, because you can't just deliver it here in Los Angeles or bring people to LA. We need to be able to understand how care is being delivered in those countries and in those environments. So I think it's a combination of all of that. We embrace that. We want to do more of that. It can be difficult because you also got to train your people, right, in your country and locally, and that's a pretty resource-intensive situation. But I think, in order to really be a global healthcare provider, you have to kind of look at it from all angles, not just the care delivery. You can't really tease out one or the other. So we're very engaged in education. I think research, we're continuously looking for ways, how do we, collaborate, whether it's clinical research trials to expand access to care for patients, or expand access to, for our own providers to patients overseas and vice versa, to come here and enroll in clinical trials. But I think it goes beyond that. I think we can see today's world is changing rapidly. And, the United States, in the past I've written and talked about, it's not sustainable that the U.S. would fund more than half of the dollars it takes to do biomedical research for the world. I think it's changing. We still remain, kind of the dominant environment, both in providing resources and situations to do research, but also executing them. But I think many, many countries are catching up, from South America to China, obviously Southeast Asia, and don't even have to speak to some of the areas in the Middle East and in Europe. So I think that is changing and needs to continue to change. And I think countries, it's almost a call to countries and governments to put as much attention into the funding and developing research and innovation and opportunities, and you got to create that competition. So I know the UAE has been so active over the past few years in trying to really move that forward, and kudos to the government and the private sector for that. But it needs to happen more, in my opinion, definitely.
Cedars-Sinai is not doing small stuff either. I was reading about your hospital sending stem cells into space to test how they grow in zero gravity. How does that end up impacting the patient experience in LA and in other places around the world that you now touch?
Yeah, I think we are like the quintessential, when I was coming up through the ranks and doing my research fellowship during my training, translational, was kind of the buzzword, doing translational research. And I'm a translational researcher. What we did in the lab, we tried to bring to the patient's bedside. And we had NIH-centered grants, et cetera, involved in that. And I think when I've come to Cedars-Sinai, we don't have a university. we're really focused on building our academic enterprise around patient care and clinical care delivery. And I can't think of an environment that's better for doing that. Things are pretty streamlined here, and there's some really magic happening in our research labs and in our clinical wards, including things like stem cells and trying to understand how we can use them as tools to stamp out diseases, regenerative diseases and neurodegenerative diseases, and many others. So, I thank you for highlighting what we're doing at Cedars-Sinai, but it's not only a hospital for the stars. It's not only a place where you get complex care, but we're continuously bringing on leaders in medicine and building programs around them.
You've built all these bridges. You have these collaborations, either directly or indirectly, taking care of patients around the world. Have there been surprises or discoveries that you feel like you wouldn't have made if those bridges hadn't been built and you were just focused on the closer community in California and the U.S.?
Oh, absolutely. And I think it's evident. I got into international by, not strategically, as I'd mentioned earlier, doors open. And really what it was through our collaborations at the time at Hopkins with the hospitals in Abu Dhabi, we started to discover that things that we took for granted, which is in my case was doing aneurysms, aortic aneurysms, and minimally invasive, what was called endovascular techniques, as advanced of a country the UAE is, they had yet had the volume or just the ability to treat patients. And so instead of traveling, I actually went there and went to our hospital and did the first aneurysm repairs. And, they put in the Gulf News. This was about 2007, and it was really exciting. But what opened my eyes to the reality that, access to care is not just, it's not just an economics thing or how poor or rich country you are. It has to do with so many things, from regulatory environments to technology to adaptability, et cetera. So, I think that those principles have driven me in my career and going international. And I think if you look at the field in general today, 15, 20 years on, I think that's happening everywhere. And the connectivity is more evident than ever. It's not just about destination healthcare. I mean, it's thriving, and it's thriving well, I think, the medical travel and destination healthcare. But I think it's thriving today and in the future, mostly because the sustainable relationships being built between educators and researchers and providers across country working to solve problems. And I think all getting to a certain level of ability and capability to do that. And I think that's the critical component to that. And to me, that's the sustainability. The other piece that's not quite as developed might be the development of standards, and that's a healthcare issue in general, so that you would enter a hospital in LA or enter the hospital in Abu Dhabi, and you should expect to receive essentially the same journey for a condition, and it should not be different. And I'm not saying that it necessarily is completely different, but I don't think that we're able to communicate and share, reporting and standards across countries. And still today, there is no international body that there is accrediting, and that's helping create standards, but that's not actually benchmarking and being able to compare. And a lot of that's happening at specialty level, within a cardiac surgery or within, cancer, through societies, and so it's finding ways to report data and developing definitions and standards of care. But to me, that's like kind of the last mile. You build the sustainability through relationships, but you need a common currency or language, and that language is through creating standards of care.
What global health challenges are you most passionate about solving through these sorts of models?
Well, I mean, I think it's probably that it's creating consistency, and standards of care. That's what, as I transitioned from being, I mentioned a little story early in my career. I was one of these physicians that was going overseas and delivering care, receiving patients, and then went into sort of the hospital management overseas, and then came back in leadership roles within the international team, whether it's at Hopkins or here at Cedars-Sinai. And I think, I think in that journey, for me, is an evolution towards recognizing the lack of these international standards. And I use the common one. I think everyone's familiar. You always at least gravitate towards travel and, air travel, and how equipped they are with, sort of processes and standards. And that's how they operate, so that you go into one airline or another one, you don't really feel different, other than maybe some of the experience in your travel. And I know it's overly simplistic, but, that's sort of how my mind thinks about it. And I think in healthcare, we have a long way to go. And it's just about, you got to collaborate across multiple levels. You can't just make it so organic. So I think our government needs to do a much bigger job of promoting and developing global healthcare, and that then takes you to actually having relationships. We can call that healthcare diplomacy if you want, but government to government relationships about creating standards, and that can then filter down to the marketplace, whether it's private healthcare or whether it's insurance payers or whether it's whatever. But I do think there is a role for all aspects of this ecosystem, if you will, to think globally and to create standards of care. And so, like when I was, one of the things that's driven me through these affiliations. So when I was at Johns Hopkins, one thing we had was at one point 15 or 16 international formal contracted affiliations with private hospitals or government hospitals. And as opposed to the Cleveland Clinic model, for example, that probably, at least historically hasn't had the number of those, but they do have very deep sort of vertical ties, whether it's Cleveland Clinic, Abu Dhabi, or London now. But, my view of the beauty of having multiple is you embed in that hospital or B2B collaboration core standards of care. The process, the quality, and the reporting transparently becomes the whole point of that relationship. And so, you may not own the asset, you may not manage it doesn't mean, though, that the care is not transforming. And I think your layperson doesn't understand how important those relationships are and the halo effect it is on the whole healthcare sort of paradigm and development around the world. And so that, to me, is moving kind of from the backwards way, rather from top down, but bottom up, towards creating standards of care. And so that's what I'm really passionate about. And we're continuing to evolve in that way, and in a different way at Cedars-Sinai. The importance of partnerships in countries, the importance of creating the hospital-to-hospital or B2B relationships, and the importance of embedding that or anchoring that in quality standards and reporting and transparency. So you then to begin to build a network.
And now that you've done it for so many years and you've started answering this, how do institutions partner best? You've described different models, right? And frankly, it's clearly knowledge transfer, experience transfer, spirit of collaboration and capacity building. But what else? What does it take to get this right so that we can see more of it happening in more places?
That's a great question. And I think, let me start by stating, clearly and emphatically that I think more of it should be happening. Unfortunately, there's so much talk about perception and about impact without really understanding, getting under the hood. It's really more sort of the talk in the community, if you will. And I do think these relationships have tremendous impact on healthcare in general, that transform to saving lives and improving the healthcare experience on both sides, because you learn from these relationships. Even let's just take it from a Cedars-Sinai perspective and adopt some of the things we learn through our partnerships. I think that there's, from you get into the model of it, from transactional consulting engagements to long-term strategic collaborations, affiliations, and up through management and joint ventures and wholly owned assets, and there are different models, at least to take it from U.S. hospital side, that our peer institutions have taken. I think the most important thing, regardless of and I always, when we start these conversations, I get it. If you're talking to investors or those who are going to fund or bankroll any type of engagement, they're very interested on the model and a return on investment, and then they should, and that's part of what you need to do. But I think what really makes it successful is about matchmaking, and so it's really, really about matchmaking. It's matchmaking your expectations. Kind of the evolution of the conversation should be a little bit of, I use this word loosely, but therapy is the word that comes to mind. Maybe it's not therapy, but more of counseling, if you will, for each other. And through that conversation, you begin to learn about what is your intent, what is it you hope to achieve. And that actually helps us on our side too, because we have those same conversations at our executive board level. And we never pursue an engagement for the ideas is to make revenue or it's really about impact. And so how do you what is the currency for that? And there's many of them. So there may be projects deep within a narrow specialty area, that allow us and our providers to improve. And so we can deliver better care and vice versa. So, I mean, I do think it's a long-winded way of saying it's not about the model, the business model that you create. There's so many ways to do that. It's really about the intent, the expectations, and then being very purposeful about how you attack that sort of project or relationship. And one of the things, and I don't mean to put shade on, I never put shade on where I've been or what I've done in the past. But we're at Hopkins. One of the things the halo effect, as I mentioned, even if you take Abu Dhabi, for example, of the amount of people that were trained and developed and the learning that came out of the relationship has been incredible. But there's also a way of communicating that to the world. And when I say the world, it's not just out there, but also in the business world. And how do you communicate that, and how do you make sure that you're continuously monitoring achieving expectations? And that's something that I think is not inherent or tacit. You need to be very purposeful of how you do that.
Dr. Hassoun, thank you so much for being with us.
Thank you. It's been a pleasure. Enjoyed the conversation.
Thanks for listening to this episode of the Health Beats podcast. For more healthcare industry news, visit the Abu Dhabi Global Healthcare Week newsletter. The link is in our bio. And if you're interested in meeting me and our guests in person, join us at Abu Dhabi Global Healthcare Week. It's taking place May 13th to 15th at ADNEC in Abu Dhabi in the United Arab Emirates. Thanks for listening. Like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Healthcare Week for your healthcare industry digest.